Are you starting menopause or struggling through perimenopause and wondering about bioidentical hormone replacement therapy? Let's talk. Bioidentical hormones are a great way to ease the symptoms of menopause. Bioidentical hormones are compounded from plant sources rather than synthesized in a lab. They're called bioidentical because they look and act just like the hormones your body makes. BHRT stands for Bioidentical Hormone Replacement Therapy. BHRT must be prescribed by your healthcare provider and is created just for you by a compounding pharmacist. Now, not all pharmacists are trained to compound hormones, but they all use the same USP grade hormones, which are standardized amounts of progesterone, estrogen, and testosterone. Bioidentical hormones are compounded into transdermal creams or gels, sublingual drops or troches, which are like lozenges, and sometimes capsules. The safest ways to take bioidentical hormone replacement therapy is transdermal through the skin or sublingual under the tongue. Taking BHRT orally in capsule form can be dangerous over time. That's because when you take hormones orally, especially steroid hormones like estrogen, progesterone, and testosterone, they're processed through your liver and will increase your risk of making blood clots. That's why the Women's Health Initiative study had to shut down, because they were giving women oral hormone replacement therapy, and many were developing clots, which led to strokes and heart attacks. The study was also using synthetic progestin, which increased the risk of breast cancer in the subjects. Now, it took 5 years to notice the trend of blood clots and cancer risk. So if you've just started oral BHRT, don't panic. Talk to your healthcare provider about switching to transdermal or sublingual. Now, sublingual or under the tongue oils or troches that you suck go directly into your bloodstream, and they do bypass your liver. Transdermal creams or gels get deposited into your subcutaneous fat and then go into your bloodstream to be delivered to all the cells that need help. I only prescribe liposomal-based creams rather than alcohol-based gels for my patients who choose to use BHRT. That's because estrogen and progesterone are steroid hormones, and steroid hormones are fat-soluble, meaning they need a fatty base liposomal in order to be fully absorbed. So why would you consider using BHRT? Bioidentical hormones can really help with menopausal symptoms like hot flashes and night sweats, insomnia and mood swings, even brain fog. Bioidentical hormone replacement therapy can help prevent and treat bone loss too. The choice to use bioidentical hormone replacement therapy is very personal for each woman. If you choose to use bioidentical hormones, you will need both estrogen and progesterone. They work together to help ease your symptoms. And bioidentical progesterone helps to protect you from cancer risk. In my next video, we're going to talk about how long is safe to use bioidentical hormone replacement therapy.